Welcome to Common Ground with SMK Medical, your gateway to uniting healthcare professionals and addressing the industry's challenges. Navigating the complexities of healthcare requires not just awareness, but a deep understanding of the latest trends, policy shifts, and innovative breakthroughs. Common Ground offers a platform where these crucial conversations unfold, connecting you with the global pulse of healthcare achievements and strategies. We bring the world's leading healthcare minds directly to you, featuring comprehensive interviews with executives and experts from every corner of the globe. These dialogues are designed to offer diverse insights and wisdom, enriching your perspective and approach to healthcare. Today, guys, I'm super excited. I have the privilege of interviewing your Jerry godmother. In today's episode, we're privileged to welcome Dr. Nakisha, CEO of Aging Like Royalty, and a dual board certified internist and geriatrician. Dr. Nakisha is famous for pioneering contribution to seniors, advocating for a paradigm shift in how we perceive and manage aging. She joins us to share her expert insights on aging like royalty, ensuring seniors live with dignity, and navigating the challenging sandwich years. Additionally, we'll explore her successful journey as a best-selling author, diving into the wisdom she shared with the world through her writing. We're thrilled to have Dr. Nakisha with us to uncover these important topics, offering our listeners an invaluable opportunity to enrich their understanding and approach to senior care. But before we dive into this enriching conversation, I have a quick reminder. If you find this discussion valuable, please show your support by liking and subscribing to this podcast. Your engagement is crucial to helping us reach and connect with more listeners just like you. Now, without further ado, let's extend a warm welcome to our guest, Dr. Nakisha. How are you doing today?
I am great. That was
Listen,
an important introduction. I am feeling very excited, looking forward to having an interesting talk with you today.
listen, I am excited that you are here. My listeners know, right? I'm a registered nurse by trade. My
Mhm.
whole life has been nothing but senior living, long-term care, dealing with seniors, and I didn't start off at 18 making it my life's mission, but
Mhm.
here we are, and I'm
Yeah.
interviewing a physician who is board certified, right, in that
Mhm.
area. So, thank you for taking time out of your day to chat with me. As I always say, I did that introduction, but it doesn't hold a candle to who you really are. So, can you introduce yourself for us?
Thank you very much. So my name is Dr. Nakeisha Rodgers. I call myself the Jerry Godmother, and I just really, have a passion for older people, my seasoned saints, I like to call them, my savvy seniors. And I just really believe in making people have education, but not just education, but wisdom to apply what we're teaching them so that they can basically have a great quality of life. So I hail from the beautiful islands of the Bahamas.
There it is.
Yes, you hear the accent. So I hail from the 242. I'm the youngest of six.
Wow.
And my parents are now in their 80s, so they are doing their aging process. And I team up with my sister, my younger sister. Oh, she's closest to me. Her name is Katrina, and
Yes.
she's an amazing caregiver. And I think navigating the aging process for our parents together as a unit has really spawned, this thing, this age like royalty, because I'm dealing with it right now.
You know what? And you mentioned something. You said you are taking care of your parents, and in the introduction we talked about the sandwich generation. And I imagine that's kind of where you are with the sandwich generation. I don't know if you have kids or not, or your sister have kids or not, but it seems like that's really that sandwich generation is when we transition from being taken care of to
Mhm.
taking care of our parents. So can you tell us a little bit more about the sandwich generation?
Yeah, I mean, you pointed out very correctly. There's a lot of people that they have their young kids, they have their careers, etc. And for me, with dealing with my parents, now my parents are very independent. Let me
Yes.
get it straight. So they're still very feisty, very sassy. In fact, my father was doing his crossword puzzles before I came on to talk, and I was like, "Daddy, I need to borrow a lamp quickly." And he's like, "Look, I'm in the middle of my puzzles." So they are very sassy and savvy, and I love it. But they, even though they are still very functional, they have some limitations, but they're still, mentally, cognitively very, very sharp, we've realized that there are things that we have the privilege and pleasure of doing for them, just to make sure that they're safe at home, just to make sure that things are done in decency and done correctly. So my sister and I have spotted things that need to be done, and we've been more active in doing those things.
It's amazing, right? And I'm sure it is a pleasure to be able to give back and take care of your parents because I'm sure they're poured so much into
Oh my
you.
gosh, yes. I don't, I can only speak for me. I've heard people say that, oh, I have to live my life and I'm not obligated to my parents. They'll speak for yourself. For me, I know, growing up, the sacrifices. I look back now as a full grown woman, obviously. And I see, the times they were getting up early in the morning to get all five of us. It was six of us. My older sister passed away.
Trying to hear
But
that.
seeing the sacrifices they made, getting up in the morning. They were teachers, so we would get up. They would get up like around 4 o'clock in the morning to get
Wow.
us ready. And I'm like, oh my gosh, I could barely get myself up. So how are y'all doing this for like five of
Yeah.
us? We had well packed lunches. I mean, they were active, always there, and I would see them getting ready for school in terms of getting their classrooms ready for the new year. So for me, education and knowledge and all that was always modeled to me. So I'm like, I don't care about anybody else, but for me and my parents, I am
Yes.
to do what I have to do for them.
I love it because one, my wife is an educator, so I know exactly what you're
Oh,
referring to. My wife is an educator,
yes.
and your parents are really your first love,
Yeah.
and to hear you ooze this love for your parents, and you talk about your childhood, and you talk about what they did for you guys. Like you say, I can barely get myself together.
Yeah.
Five, six other people, whoa,
Hmm.
right? But they do it unconditionally. But I think what happens, right, is as people start to live their life and our
Yeah.
parents start to age,
Yeah.
it's not that, and to your point, right? I think people say, I have to live my life, I have to do this. I
Mhm.
think they look at seniors as becoming a burden.
Exactly, exactly. And I think, and a lot of that is through culture, the culture, the
Yes.
media, the way we portray getting older. Sometimes you'll even go into Hallmark and see the cards for birthdays. And to me, it's kind of ageist if you think about it. And I love those cultures that really, hone in. I have people that I know from the Asian culture, from the Filipino culture,
Yes.
and they revere their seniors. It's all about, these people have poured into me. This is about respect and honor. And so for me, the whole age like royalty is like they deserve to be treated with that honor and that respect and that dignity, and not to be seen as a burden, but the fact that you get to live with somebody and
Yes.
get nuggets of wisdom from them and avoid a lot of the stuff that they can tell you that right now there are times, honest, I'm getting excited, Demetrius,
I
but
love it. You're
I
passionate.
they give me some really good life advice, even down to like career advice and so forth. They're not in the medical field, but I mean
Mm,
that wisdom that they have, it's just amazing. So the fact that you get, God has blessed you to have your parents around, you don't take
yeah.
that for granted. You don't see that
Yeah.
as a burden. You see it as a blessing, and that's how I see it.
One of the things people always made fun of me for when I was a kid is they said I had an old soul.
Oh,
And
me too. You got called old soul too?
yeah.
Yes, yes. Yeah, the old soul. A young person's body, right? You got that one too.
Yes.
Yep.
And, so growing up, my friends were often people much older than me, right? The
Yes.
seniors, people truly who were older than me. And for me, I looked up to them because, to your
Yeah.
point, they had nuggets and
Yes.
they will instill those nuggets if you would just listen.
Exactly. Exactly. I mean, because they've been through the stuff that you're going through. Like, honey, been there, done that. And so you get this opportunity to avoid the ramifications just by listening. Just by
And,
listening.
you hit the nail on the head. And for me growing up, right, I gravitated to them because I feel like if you've experienced it and you tell me not to go to that door because it's hot, I'm not going to go to that door because it's hot. I'm not one of those people who got, it burns, right? That ain't me.
Yeah, me
You
too.
said don't go, but I don't know if that led me into a life of dedication to seniors or not. I don't know. And we can chat about that later. But did that lead you into becoming the person you are today?
That's a good question. I think, like looking back at it, I could see where God had my steps, ordered. I couldn't see it at the time, but when I sit back and my parents and my sister, we sit back and we look at it, and I'm like, this is not a coincidence.
Yeah.
I think growing up, yeah, I was called the old soul. When I would go, and I tell this story all over, but it's the truth. When I think I was like 5 or 6 or something like that, no, 5, we had this on the island. There was this bakery store that would sell these twists and donuts and so forth. And I had to pass, it was called Blue Hill, it's still called Blue Hill Road, but there's this that got my school to my house. So like a travels the span of the island. And there was this bakery that I would always insist at the age of 5 that my parents stop there. And they couldn't understand, why is she going to this bakery? And at the time, I think a twist was like 25 cents or something like that. But one day, my mother came inside and she's like, why is she taking so long in there? And she realized that I was having a conversation with the patrons, and the patrons were, it was, I think they would have been like in their 70s. I just look forward to him asking me how my day was, what words did I learn in school? And he had his wife would be there. That was my first introduction to just talking to an older person. And then my grandmother, my mommy's mother, my maternal grandmother, we spent a summer. She passed away when I was about 12, I think. But we spent a summer, like 2 summers before she died. My mother had me and my sister go spend the summer with her, and it was so much fun. I mean, I would go, the island was called Andros. So it's this big island.
Yeah.
And it was by the water. And so she would go, we would eat like cocoa plums, and we would, go to visit her. I would go with her to her friends on the settlements, they would say. And she had this older friend that would have been like in her late 70s. And I could go and hang out with my sister and I guess the younger children on the island. But I preferred to just walk with my grandmother to visit her friend. And her friend was called Trouble. At the age of 75, that was her nickname, Trouble. So come on. It's either go to the beach with the children or go hang out with Trouble. And I'm like, why
Yeah.
is she called Trouble? So, and she was hysterical. Like the stories they would share, I just really enjoyed it. But I always had a knack for just being around wise older people.
I love it, and I am all in and just hearing your story, because this is what I do, right? My actual project, my thesis is on reducing falls for seniors in long term care settings, right? So
Okay,
I am passionate, right? As you know, falls takes them out, right? They
that's it.
fall, they get a hip fracture, they get pneumonia, and
That's it.
so for me, I am passionate about it. So to hear you speak about it is very interesting. And one of the things that I do is double board certified, and I think a lot of us know what an internist is, right? Everybody has an internist. We have that, but
Mhm.
you're certified in another area. Talk to us about that, and what does that mean? Because many people don't know the term, and I'm deliberately not. I'll let you introduce it, but many people don't know that even exists. So talk to us about it.
Oh yeah. So the geriatrics, and I always, my sister's like, it doesn't sound sexy, Keisha. I don't know. I was like, that's just that's specialty, the subspecialty. But I tell people it's the flip side of pediatrics. So if you know
Yes.
what a pediatrician is, taking care of the beautiful babies, I come back at the other span of life, that beautiful period over age 65. And we just kind of walk you through those different decades. But the whole goal of being a geriatrician is you just want to help people to function. So, whereas, we still look at the heart attack, we look at the stroke, we look at the atrial fibrillation, but we're looking at what is the effect of all of those conditions on this ability to still, you drive a car, still, pay your bills, still, dress yourself each day. How do all of those things line up? And so my goal is to sit down, put my thinking cap on, and figure out what are the social things that need to be in place to help you to function. What are the physical things that need to be in place? What are the spiritual things? All those things, that's my focus, like pulling it all together in a nutshell.
You know what? What I just heard you say is you treat the patient holistically.
Yes.
You care for the mind, body, and soul.
Yes.
You're
Yeah.
thinking about the patient in terms of everything, from a standpoint, from a
Yeah.
psychosocial standpoint, from a financial standpoint. Because
Yeah.
if we're being frank, all of that contributes to your quality of life and how you live and how you perceive
Exactly.
life.
Exactly.
So, you have you're in a prime spot, and I love what you do. I love that you're board certified in it, and it's clearly a passion. And you've taken that passion and you've kind of coined the phrase "age like royalty." What does that mean?
Yeah, I think basically about initially when I thought about it, I thought about like my parents. And one of the things that they're fierce about is, no, I'm not going to be a burden to anybody. I'm going to, fend for myself. And so it was always this thought, this independence. And so for me, when you age like royalty, it's about being able to call your shots, being able to be in charge, making decisions for yourself and having that dignity, not, being prepared. When you think about royalty, you think about, these are people that are treated with respect. They call the shots. No one's kind of bossing them around. So initially I thought about, age like a boss. But then when I thought about, the beauty of aging and, getting older, I was like, you know what? No, they're royal, age like royalty.
I love it, and you know, it's changing the mindset for people
Yes.
across the world because
Yeah.
I always say, and I mean with love, but society often doesn't care about people who are not paying taxes. So they don't care about babies. I just being right because when we look at how our seniors are treated,
Yes.
and I am a licensed nursing home administrator. I love the seniors. I am passionate. I am seniors, but I
Yeah.
look at some of the way our seniors are treated, some of the issues they have with accessing healthcare.
Yeah.
Healthcare access is not easy for them.
No.
As I'm working with organizations, I'm trying to make it user friendly per se for seniors,
Yes.
right? Down to when they call and you're rambling on a phone and say press 1, 2, 3, 4, 5.
Yeah.
That's not quite as easy for them, right?
Exactly.
Or as we sit there as healthcare providers, right, and we're
Yeah.
explaining that you have hypertension. Well, they never heard that word a day in their life.
Exactly. Exactly. You gotta say blood pressure. You gotta say sugar. Make it
Ooh.
make sense.
So, what role does providers have in educating our way that they can understand?
I mean, now I will say, don't assume that because somebody is older that
Yes,
they're not very well versed
I
because
like that.
I have seniors. In fact, I saw one of them today. She's 87 and fabulous and very well versed. I mean, she emails me when she reads up on different studies. She's like, Dr. Rogers, what do you think about this? And I just absolutely love it. So you can't generalize, as with any population, you don't want to generalize. And then you also don't want to break down in such a way where it's like, oh, talking like a baby, because that can also be, taken out of
Hmm.
the wrong way. But you just kind of, how would you speak to your grandmother? How would you speak to your auntie? And I always think of, you know, I believe, you reap what you sow. So I'm like, when I'm not around, I would hope and pray that the people that are caring for my parents are going to treat them the way I'm treated. This is someone's grandmother. This is
Hmm.
someone's mother. So, sometimes you have to remember, let me make sure that I explain things in a way that they can understand. And so, what I do at the end of my visits, and I teach my students, is I make them get a paper. And someone taught this to me, and it's so simple, but it makes much sense. So I would always get a paper, and then we narrow it down to just say maybe 3 or 4 points from that visit. And of course, you can get a printout like the doctor's visit. But I find a handwritten, just in simple terms, and I'm like, okay, what's your homework? And they know just, yep, where's my homework paper? I'm like, you know it coming, homework coming.
And
So
but you know what?
mhm,
Which is important, right? Because we can give handouts to a blue in the face, but a lot of times, me included, we not able to function in right. We may not be able to read that handout. We may not be able to see that handout, and we
yeah,
don't know. When we talk about macular degeneration and glaucoma, they don't even know that their eyes. Some people don't know that their eyesights are going bad. It just kind of becomes the
exactly,
norm. So them not
exactly,
seeing it, it's something that we have to consider. And with that
yeah,
being said, from a provider standpoint, right?
yeah,
I'm sure you're assessing them to determine why they're in a situation that they're in or their health
yeah,
status is like it is. Because
yeah.
to the point, if you just hand them a handout and say, "Hey, here you go," and then they come back and their blood pressure is the same level or the A1C is still 7, despite your
Exactly.
interventions, we
Yeah.
have to change our tactics. So as a provider, And you mentioned that you're teaching students. What are you teaching students about our seniors and bettering the lives of our seniors?
I teach them that they make a difference when they are interacting with these seniors. I teach them that it's a privilege. Like, don't go in this room making assumptions or saying, oh, this person is such and such, so we're not going to do this. No, no, no. To assess this patient, we're going to see if they're fit, vulnerable, or frail, and then we go from there. But we don't just say, oh, because you're 80, we're not going to offer this. And that's not what we're going to be doing here. We're going to be comprehensive. We're not going to deny people care, but we're also going to do it effectively and make sure that we're justified in what we provide. But I teach them, talk to, slow down when you talk.
Yes.
Don't go in the room and ramble on, but first of all, know how to address them. You're not going to be going in here. You have a lot of seniors came from different walks of life, different eras. And so don't assume that you can go in and say, hey, Bob. No, it's, hey, Mr. So and so, ask how you want to be addressed. From the minute you enter that room, make eye contact, sit at eye level, speak slowly, just be friendly, but make sure that they, understand what you're discussing and ask them, is there somebody else that you'd like me to discuss this with? So a lot of my patients, my students' patients, we typically tend to try to have a relative of their choosing at the appointments, especially if we think that there's some cognitive impairment. And if that relative cannot make the visit, they always know, like, oh, okay, and we know Dr. Rogers is going to tell us what to do. I'm like, you got to go on the phone and call her daughter, right? And let her daughter know what we just, yes, Dr. Rogers. So they know it by now. So
Yes.
it's beautiful to watch. I mean, I can think of one in particular. I mean, they're all really, really great, amazing. And one in particular, I mean, the ladies just love him, honestly. They look forward to coming to see him. They get all dressed up, and it's so cute. But he has done an amazing job in, transitioning a patient in particular who was having a lot of, falls and stuff in an
Hmm.
independent living. And he was able to get the process started with her daughter who was out of state, get the information to her, kind of help her navigate what to do, the 3008, stuff like that. She was able to take charge and go and look at assisted living facilities so that she was still able to make the choice. She's doing much better. He's been able to work with another patient. I think she's like 92, just going through her medications that somebody else had started and just trying to explain to the daughter, like, hey, mom is probably having a lot of this frequent urination because
Hmm.
XYZ. Let's try this. And through him doing a proper med rec, he's been able to have her on her feet a little bit more alert, reduce falls. So, and he's able to get, Dr. Rogers, this makes sense. Yeah, we need to see them frequently and just do one problem at a time. And I'm like, yes. So if we could just get through with them and with those simple
Yeah.
nuggets, I feel so good when I see them graduate because I know that at least something stuck with them about taking care of their seniors.
You said two important things that I want to
Hmm.
acknowledge. What you said is, I teach my physicians to be culturally competent. That's what you
Yes.
said. You said you
Yeah.
teach them to address the patient how they want to be addressed and
Yes.
not to assume that this is
Yes.
Bob or this is Mrs. Smith. And
Yes.
I was recently, and I'll say kindly, slapped in the face when I moved to Hawaii for cultural competency because
Okay.
I am used to calling people Mrs. Smith, Mr.
Yes.
John. And when I got here, everyone is auntie and uncle. If you
Oh,
call
really?
them Mrs. or Mr., you
Yeah.
might as well call them their first name.
Oh, I didn't know that. That's how it is in
Yes.
Hawaii.
Yes. So I had to learn that. And I remember walking around the hospital as a leader and hearing people say
Yeah.
auntie and auntie. And I was pulling people aside and was like, you can't say that. That's not the way. And he's like, no, that's what we say. That's what she wants. I'm like, no,
Oh,
no. It says this here. And but
yeah.
as I culturally aware, that
Yeah.
is the standard here. If you
Yeah.
call somebody Mr. or Mrs., it's seen as a sign of disrespect, right? Auntie
Oh,
and uncle here. So I had to come here and adjust to a different culture, right? I'm from Detroit, Michigan. So how we interact with people there and how we
yeah.
speak is totally different than how I interact and I speak with people here. So I had to learn that. So I want to acknowledge you and applaud you for teaching your students that. But I think the second thing that you talked about that I think is important, and I'm speaking from a nurse perspective, is the
Mhm.
importance of med reconciliation for our seniors. Okay,
Yes. Oh my gosh.
polypharmacy is real.
Is these polypharmacy streets?
Yes, yes.
Yes,
We
because
figure out by why Miss Jones keep getting on the floor at 10 o'clock, but we gave her that LASIK at 6 o'clock, right? We don't understand that
yeah,
she's going to get up and then fall.
yeah,
So, you're
yeah,
teaching your physicians the importance of a medication rec because it sounds so simple, right? We do a med rec, but we have to think about the seniors, their
yeah,
ambulation status, their ability to walk, right?
yes,
The if they use assisted devices,
yes,
what does that look like for them? And I think holistically, when we start to meet the patient at the bedside and see their environment, I'm talking senior living, or even
yeah,
when they're coming to you in an office, right, saying, bring
yeah,
all your medications with you.
yes,
If it's in a bag, bring it all. It's okay.
yeah,
I'll review it. And highlighting that because right, you mentioned two things, right? They get up and they fall because of increased urination, but
yeah,
also their cognition status, their mental status. Some medications make them drowsy at night.
yes,
So we have to provide patient-centered interventions in
yes.
order to prevent that. And I just applaud you for teaching your students that. That hit the core of me. So thank you.
Very welcome. Yeah. Because a lot of times, when someone is admitted, the first thing we'll say, go and look at the medications. If somebody has confusion or delirium on the floors, the first thing I tell them, if that nurse pages you, before you go up there and you're tempted to, I do not take shortcuts. Do not just go and order antipsychotics for people because they're agitated. Go and be a detective, ask your questions, look at the last medication that was given. If they're in pain, make sure that they're not impacted, make sure that they're not having urinary retention. Look at the medications. And a lot of times they're like, yeah, Dr. Rogers, you're right. Like this person just somebody gave them some gabapentin and that's why they're a little confused or groggy or something. So that list, there's a lot of stuff in that medicine list.
Listen, and that's not giving them trazodone,
Right. Don't get more medicines to fix a problem.
Xanax, Valium, right? Melatonin. That's not always the answer. It is in some cases, but when we're talking about preventing falls and ensuring
Yeah.
that we are really looking at our patients holistically,
Yes.
you really evaluate and get that story. So,
Yeah.
I think you've talked about once again the importance of med reconciliation, cultural competency, but I think
Mhm.
all that leads to one of the things that you're passionate about is ensuring our seniors have dignity and are respected.
Yeah, definitely. I mean, I take that very seriously. Just thinking of, these are people that worked. These people had lives
Yes.
that have been so rich, and sometimes I think sometimes my students and they're so in awe, like, oh my gosh, Dr. Roach, did you know so and so did this when they were young? I'm like, yeah, these people, you're meeting them as a patient, but they're a person.
Yeah.
And so they've led these lives and, they've invested in so many different sectors of society. The least we could do is just honor them with that.
I think it's important, like you say, to honor the patient's wishes, honor our senior
Yeah.
wishes, and I think
Yeah.
one of the things that we can do, you can correct me if I'm wrong, but as caregivers of
Yeah.
people caring for the senior, we have to have those difficult conversations with our loved ones to
Yeah.
know
What they,
what are right. So, as
yeah.
a physician, how do you prepare families to have these difficult conversations? Just because you're 65, 80 doesn't mean anything.
Yeah.
You're going to transition, but how do we encourage families to be involved and not be afraid to ask those questions so when the tests come we can properly care for mom and dad?
Yeah. I mean, I think it starts with, do things when things are good. Like you don't want to wait for a panic situation where this relative that hasn't been around and who knows how long ago is swooping in to make all these changes. Listen, every scenario I've sat there like, and
Yes.
it's like a drama. It's like, okay, you have to have the wisdom of Solomon because you're like, okay, but I used to see this daughter that
Yes.
did this, but I never met this daughter. But so you're like, God, please. So I tell people, you don't want to get in a position where it's a fight between siblings. It's something that just unravels. So while things are good, while I know a lot of my patients get a little nervous when I say, okay, hey, we're just going to go over, you're at 5 wishes, and they're like, what didn't you tell me? Like, I thought my thoughts came back great. And I
Yeah.
was like, no, no, no.
Yeah. I love the Five Wishes book, by the way.
Oh yeah, it's really, really good. I really like that. But yeah, I tell people do it when things are good.
I like that.
And I stress the fact that no, this is you kind of being empowered. This is, so you don't want to put your children through, because a lot of people will say, well, I don't want to put that burden
Yes.
on my children to make those decisions. I was like, perfect. So that is why they're basically just carrying out what you say. And I find if we phrase it like that, they're executing what you would say. I think that that's good to do it when things are good, because you don't want to be in the emergency situation and people are going back and forth. There's one camp saying do this,
Hmm.
another camp saying do that, and then it's out of control.
I think it's important, like you said, do it when times are good, when things are going downhill, and we have to make these decisions and hope that it's the
Yeah,
right decision to make. And it's especially challenging, right, when it's multiple people involved, right? Every
yes,
you you get, but then you say, so where are the papers? Where are the wishes? And
yeah,
nobody knows, right? But mom or dad
exactly.
would have wanted this,
Yeah,
and the other one's saying it this way. So I
yeah.
think, as a physician, you have a hard job, and I just applaud you for um, doing what you're doing. And I think you've taken your passion and you've turned it into a business, which is aging like royalty. So can you talk to us about your business?
Oh yeah, thank you. So basically, this is something that I just love, knowledge and education and the importance of learning. So Age Like Royalty is basically we offer just providing trusted medical education for home care agencies, professional caregivers, personal caregivers. We offer a course, and it's an online course called The Secrets of Sassy Savvy Seniors, the Caregiver Edition. That course has 6 modules. It is online. You have access to me. We do our sessions. We try to do them in a group form, where we go through, simple things as, do I need a geriatrician? What does a geriatrician do? I give you scenarios. There's quizzes. I give you some resources. We try to prepare you for not only selecting the right physician for you, but how to maximize your office visits. Because trust me, you only got 20 to 30 minutes max. So I try to give you the tips I kind of give you my playbook.
Yeah.
These are the things that makes your visit more effective. We try to give you, I call it my Age Like Royalty roadmap, so that by the time you're done with the course, it's a very short course, but the goal of it is for you to design your own roadmap for your loved one or for yourself, so that A, you know how to pick your doctor, B, you know if that doctor is right for you, how to maximize your time in the visits, how to prepare medically for the stuff that happens with aging. And you get, access to me just going through that and harping on things. So, and then we do speaking engagements. I just did the aspect of teaching and giving people knowledge. So that's what Age Like Royalty basically features.
Listen, to have access to you, the caregivers are very lucky, right? Your knowledge base is so vast. What you're doing for the senior community. How can people reach out to you if they wanted to reach out to you, learn more about your company and what you're doing? How do
Oh,
they?
yeah, so I have an amazing assistant. We are basically on our social media. We post, we try to be very active on the social media. So there's always some nugget of education or knowledge. The hashtags or the media handles are Dr. Nakisha MD. So that's on LinkedIn, Facebook, Instagram. The website is again just simple www.drnakishamd.com, and you can always get in contact with us. And yeah, those are the main ways.
Listen, amazing conversation. I got one final question. As we look forward, into the years to come, we got AI approaching. That's a whole different ballgame. But we got technology which is just running wild.
Yeah,
What is your hopes and visions for the future of aging and seniors globally?
sure is. That's a really good question. That's an excellent question. I would say for that we can just not just uh, live with diseases, but we'd be more focused on prevention. That I think that we would become a world globally where, when we think about aging, we're not dreading it. We're not like, oh my gosh, I got to get older. We look forward to it. I look at aging as this ability Actually, your vocabulary actually increases as you get older. There was a book recently about this concert pianist, and his got better well into his 80s, because he optimized. So that's pretty much known. As you get older, you tend to optimize, you practice more, and so forth. So I would want to see a world where we are embracing getting older, and we're having better quality of life.
I love that end piece, a better quality of life for our seniors. I think that is so important.
Yeah,
And, I know that our world is trying to make a better quality of life for our seniors. But I think one of the things, and this is a whole another conversation, but you said it, we have to be able to readily address is mental health, right? So we can
yeah,
have a better quality of life for everyone, but definitely for our seniors, right?
yeah.
And understanding diseases such as Alzheimer's, dementia, all those cognitive disorders that will enable them to have a better quality of life. So you ended there. I left on that, but just thank you, doctor. I appreciate it.
Your questions were so good. I mean, very well researched. Excellent. Excellent. That's why you do your thing. This is you. This is why you do your thing. I just show up.
Listen, you know what? You're making me blush. I appreciate you. Thank you for coming on to Common Ground and sharing your insights. We will place your information in the show notes. We will definitely link your website in the notes.
Thank you.
And as I always tell people, you can find our podcast. We're all over. Thank you again, doctor.
Definitely. You have a wonderful night. Thank you so much.
Yes. And to our viewers, thank you for tuning in to Common Ground with SMK Medical. It has been our privilege to share today's insights with you directly from the minds of leading experts, such as Dr. Nakisha. Our mission is to foster vital conversations about the healthcare industry's challenges and innovations. We are excited to share with you a wide array of guests coming up in future episodes. So, we want you to stay curious, stay connected, and continue listening to Common Ground with SMK Medical for your dose of thought provoking discussions. Your support means the world to us. If you found value in today's conversation, please give us a thumbs up and subscribe to this page. Let's keep the dialogue going and the community going. You can also follow us behind the scenes on YouTube and LinkedIn at SMK Medical. There, we share insights into healthcare trends, medical, all things healthcare. We look forward to you following us. You can follow me at Your Healthcare Consultant on Instagram and TikTok, where I share excellent information on healthcare education, as well as my tips to being a healthcare consultant. Till next time.